Hi friends, I am Dr. Pratap Sinator. I have done MD in Forensic Medicine. In today's video, we'll continue with general toxicology and talk about diagnosis of poisoning. Diagnosis of poisoning in case a person is living should be suspected in certain conditions like symptoms appearing suddenly after in a healthy individuals or symptoms appearing when within a short period of taking a intake of food or drink or in a group of gathering when similar symptoms appears in a person's individuals who are taking similar kind of food or drink. Or sudden worsening of symptoms in a sick person who is receiving some correct treatment and shows significant improvement or progress and suddenly deteriorates. In these cases, poisoning should be suspected. Certain group of symptoms which are suggestive of poisoning, like sudden onset of abdominal pain, nausea, vomiting, diarrhea, collapse, which is seen in arsenic poisoning. Sudden onset of coma and constriction of pupil, which is seen in organophosphate poisoning. Sudden onset of convulsions. Sudden onset of delirium and dilated pupils, like in the poisoning. Paralysis of lower motor neurons types like caused by strychnine poisoning, jaundice and hepatocellular failure seen in carbon tetrachloride poisonings, oliguria that is decreased urine and proteinuria and maturia, persistent sinuses, all are symptoms are which are certain symptoms which are suggestive of poisoning. Features which indicate of chronic poisoning where the person is exposed to small doses of poison in longer duration. Like symptoms are exaggerated after administration of suspected food, fluid, or medicine indicating that poison is present in that uh, media. The persists malaise, cachexia, or depressive and gradually deteriorates uh, conditions. Then repeated attacks of diarrhea and vomiting. If the person is removed from the patient from his surroundings, his symptoms disappears. And if traces of poison is found in urine, blood, or stool or vomit, which indicates of chronic poisoning. In case of living, usually we collect the stomach washings if possible and vomiters if the person has vomited, urine which as much as possible, and 10 ml of blood which is preserved in sodium fluoride and is sent for chemical analysis, toxicology analysis. Now coming to diagnosis of poisoning in the dead bodies. It includes, it can be done by postmortem examination, chemical analysis, experiments on animals, and documentation evidences. Coming to postmortem examination, which includes external examination and as well as internal examination by dissection of body. External findings includes first stains on clothes. Certain stains can be observed like corrosives can be seen. Some marks of vomit or poison can be obtained from the stains can be detected. Color changes on the skin, which like black color is seen in hydrochloric acid poisonings, brown color in case of nitric acid poisoning. Postmortem staining or lividity, which becomes dark brown or yellow in color in phosphorus, cherry red color in carbon monoxide, chocolate color in nitrates and nitrobenzene, etc. Odor from nose and mouth may be garlicky odor is seen in phosphorus, arsen or arsenic poisoning. Sweetish odor is seen in ethanol chloroform poisoning. Acrid odor is seen in paraldehyde chlorhydride poisoning. Rotten egg smell is seen in hydrogen sulfide and captain's poisoning. Injection marks may be present where which indicates that the poison was administered through the injection marks or the person is chronically administering the poison or he is a drug addict. Skin may show hyperkeratosis in case of arsenic poisoning, chronic arsenic poisoning, or maybe jaundice, yellowish discoloration may be seen in phosphorus. Then violence marks, if it's present, indicates that like bruises or any type of injuries we've seen, which suggests that the mode of death from that cause other than the poisoning itself. Internal findings, that is when that after dissection of body, smell will be present, peculiar smell will be seen, peculiarly like kerosene-like smell in case of organophosphate poisoning, cyanide poisoning, alcohol has peculiar smell. All these poisons have peculiar smell can be present. In mouth and throat, it may becomes corrosions may present, inflammation, or some type of corrosion because of corrosive inflammation or irritant poisoning may be present. In esophagus, it may be markedly softened because of corrosives and alkalis. Upper respiratory tract may show evidence of some volatile poisoning like phosphine gas poisonings. Stomach after dissection may show hyperemia, color changes, softening, ulcers, perforations like based on different poisoning like corrosives or irritants. All the contents should be emptied in all the contents of stomach should be preserved and sent for chemical analysis in a saturated sodium chloride solution. Duodenum intestine may show ulcerations beyond Fowler's point to natural disease. Characteristic changes are seen in mercury poisoning. Normal GI tract rules out poisoning by corrosives, phenols, and mercury poisonings. Liver, mainly case of phosphorus chloroform, leads to necrosis liver. Fatty liver is seen in case of arsenic and chromatide chloride poisonings. In case of respiratory tract, corrosive poisons leads to glottic edema and congestions. Kidneys, metallic poisons, catharidin poisoning leads to kidney changes. Oxygen-converted reduce get necrosed in case of mercury chloride poisoning, phenols, lysols, and chromatide chloride poisoning. Heart may show subendocular hemorrhages in left ventricular in acute arsenic poisons. Bladder, vagina, uterus should also be examined for presence of any evidence of renal abortions. Samples which are preserved in case of living and dead are usually sent for toxic analysis. In case of dead, we usually collect the blood, which should be collected from the venous sample. In the dead, we should not be taken from heart or great vessels because it may be believed postmortem contamination from stomach or from aspirated vomit in the air passages. Vomit and stomach contents is preserved. Vomit is placed either in a clean glass jar or plastic tube and tight-filled lid. Liver and other organs. Liver, entire liver or half of liver with gallbladder should be preserved in a clean container. Half of each kidney is also placed in separate containers. Then hair and nail clippings are only preserved in case of heavy metal poisoning suspected. Then usually some hair and cut are pulled out the roots together with the nail clippings, which is submitted for analysis. Feces, the contents of rectum are not often required for analysis except in cases of metal poisoning, such as arsenic, mercury. The samples must be meticulously labeled. Each jar should be labeled, particularly conditions that the patients, the case number, the history, the symptoms, the appearance of contents, stomach contents, the appearance of any symptoms should all be present. Doctor's signature should be placed on the label. Sample should be handed to a specific person, often a police officer whose name is noted, will take the sample to the laboratory to maintain the chain of evidence. Now coming to chemical analysis. So that from post-examination, we can only detect certain poisons from based on the external and internal findings, but specific poison cannot be detected. That's why we go for chemical analysis. Chemical analysis organs are removed from the required preserved organs like stomach, intestines, liver, kidney, which are preserved, are removed and kept in a clean container, and analysis is done. Specimen of blood, urine, bile, etc. should be kept in glass containers. Specimen of choice usually is for blood. Urine is the ideal choice for direct spot test in death due to delayed poisoning. It is also only specimen to show poison substance in chronic poisoning death. In advanced decomposition, thigh muscles may be helping detection of poisons. It is important to keep liver, kidney separately from the elemented carrot as some poisons are permeable and may enter these tissues. Coming to analytical procedures, the samples which are sent usually may undergoes rigorous conditions to for analysis. First, they separate poison from biological tissues. Then purification of poison substance take place. Then it is detected with different quantitative estimations by thin layer chromatography, gas chromatography, mass spectrometry, UV spectrometry, and immunoassays. Immunoassays includes enzyme immunoassays, fluorescence immunoassays, and radioimmunoassays. Except for gas chromatography, mass spectrometry, none of the methods are totally specific. So gas chromatography, mass spectrometry detects the poison up to the minute quantities. Gas chromatography, mass spectrometry can detect the poisons into as five groups. Group 1 includes gases. Group 2 includes steam volatile substances like alcohol, benzene, nicotine. Group 3 includes metallic poisons. Group 4 includes non-metal volatile organic compounds like chitin, cocaine, and Group 5 are the miscellaneous compounds which are not present in the four groups. Certain factors which influence toxicological analysis. So these factors affects the detection of poisons like age and weight. If the poison consumed is totally distributed evenly in the body, it may not be present in the organs. Presence of natural diseases. If certain conditions, certain poisons may be eliminated. Traumatic lesions. If the person is already hemorrhagic, the poison which is absorbed may be eliminated in the hemorrhage. Degree of tolerance. If the person's tolerance is enough, then the poison may be not be present in the blood. It may be tolerated enough, and he may have symptoms also. And hypersensitive reactions. Certain poisons, even the minor quantities, may cause severe reaction if the person is hypersensitive. Putrefaction, which is a form of postmortem changes which occurs, can cause certain changes. Postmortem decomposition. In postmortem decomposition, many poisons present in the tissue undergo chemical changes and cannot be detected. Putrefaction normal tissues may produce substances which give chemical reactions similar to those of obtained from toxic compounds. It may also release certain compounds like alcohol, even though it is not present, even though the person may not be consumed alcohol. Failure to detect poisons. Even after analytical procedures, sometimes poison may not be detected. Like if the poison is already eliminated in vomit and diarrhea, if the poison has disappeared from lungs by evaporation or by oxidation, if the poison may be detoxified, conjugated, and eliminated from the system. Sometimes vegetable alkaloids may not be detectable at all. Some drugs are rapidly metabolized and are not detected. Toxins and venoms, which are protein in nature, cannot be separated from body tissues, which should be detected by immunoassays. If the poison acts slowly and death is delayed and poison may be completely excreted, treatment may alter the poison substances. Then many drugs may present in very small amount for identification. The wrong or insufficient material may be sent for analysis. Because of that, also the poison may not be detected, leading to failure. All positive results where even if the person has not consumed the poison, positive result comes when the poison enters the body regularly in small amounts with food, water, or air. Due to decompositions, gases and alkalis are released by the bacteria and they convert the living tissue into certain kind poison substances. Anticoagulants which are used in the living may also cause may be false due to all positive results. Regular intake of arsenic, mercury, and lead by the food and water may also be detected by the chemical analysis. And therapeutic use of arsenic, strychnine, and sedatives may also may be conditions where poisons may be detected. Nicotine in the blood of smokers is also present. Chemical burns due to gasoline also may be detected due to false positive results. Faulty technique of sample collection may lead to positive results. And contamination of blood with stomach contents. As I mentioned, certain poisons may be permeable. So from the blood, from the stomach, the poison may have entered the blood and it may lead to false positive results. Third, thirdly, experimental animals. So this is not an ideal test, it's unethical and it's usually not done. It includes that the blood samples which are present from the obtained from the dead is injected into the living animals and they may not produce signs symptoms similar to the poisons, but absence of signs symptoms it may be because of it may be because it may not be insusceptible to certain poisons. Then circumstantial evidence. Such evidence may consist of motive, evidence of witness about the recent purchase of poison, his behavior, commission of offense, and recovery of poison from the possession of the accused. So this is also circumstantial evidence based on the accused, how he purchased the poison or where he has taken if he has purchased the poison. Based on that, the diagnosis can be done of what is the person has, how he poisoned. These are my references. Thank you.